Hi, I'm Dr. Carine of Carine Pediatrics. I want to give you an update of what we're doing for COVID-19. First of all, we are open. We are open for so many reasons, but most importantly, for the health and wellness of our patients. We are very committed to the growth and development of children and keeping them safe and well, and that doesn't stop because we have this crisis of COVID-19 coming on. So well checks are going on, and they're going on because they still need to be checked. Babies need to know they're growing, that they're feeding, that they aren't jaundiced. We need to make sure children are meeting their developmental milestones. This crisis could go on for months, and it's just not safe for us to keep our children without adequate preventative care. Vaccines will continue as we have them because we can't have the risk of children both catching COVID-19 or something else on top of that. We need to keep our children as safe as possible. So therefore, we will continue business as usual as it comes to our well child care. What are we doing for ourselves and for you to keep our patients safe during that time? First of all, we have a completely separate entrance on a separate floor of the building for patients exhibiting any illness symptoms. And we're encouraging everyone to come through that door, whether they're here for a well check or for a sick visit, if they're exhibiting any cold symptoms that might make them contagious. During this time, our staff are being outfitted with materials. I know you've heard that we don't have masks and gowns, but we do have them when we feel like we need them, and we're wiping down everything from our instruments to our computers to ourselves between patients. We're doing everything we can to keep the spread of COVID down to the best that we can. And we also want to keep our employees safe during this time as well. The other thing that's important is that we be available for you for sick visits. Children still get sick with things that are not COVID-19. And we don't really want you to delay medical care, putting you at risk to being in the ER or hospitalized. For instance, we had a patient last week we diagnosed with cancer, and it would be terrible if her mother had delayed care because she was afraid to come in because of COVID-19. So I want you to keep those visits where you're asking us all those questions and those concerns about your children so that we can determine whether those are real concerns or ones that we can wait till later. If you are ill with cough and fever, it's very important that you follow some of our guidelines that we have both sent out in email, we have posted on our website, and I'm going to review right now. If you have fever and cough and you are not in distress with your children, please do not come to the office. So what does that look like? Difficulty breathing, breathing too fast to eat, breathing too fast to look comfortable, children that are in pain, children that we think might be dehydrated. But just because you are sick and worried it might be COVID-19 does not mean that you should come to the office. I know that's really hard to hear and it's difficult when you're worried, but for the majority of Americans, they will never be tested for this illness and they will shelter at home and ride this out. This is something that was reiterated today by Dr. Acton during our Ohio address, and that is that we have limited testing. Yes, there's been lots of discussion about testing, and I don't have time to cover all of the issues around that. But right now, due to shortages in swabs and medium, even though we have the capacity at the testing sites, we now are having to restrict even more to patients who are either critically ill or are first responder or medical care. So if you do not exhibit symptoms serious enough to be hospitalized, it doesn't matter if you've had a contact or you're concerned or you've traveled, we have limited testing to that set group now. Therefore, even if you think that you might have COVID, we want you to stay home and contact us if you feel like your child is in distress and restrict from coming into the office for cold symptoms that are not dangerous. If you have more questions about that, of course, our staff will totally be available for you. As we go forward, I think that paying attention to our daily announcements by the governor are very important. We really are at a time of war with a virus that is different than we've ever fought before. It's not a time for finger pointing, it's a time for action, and we need to stay home, shelter in, and keep sick people away from each other to limit the spread of this disease. We will be here for you. We will be here as much as we can. We will keep our staff as healthy as we can. We will keep our office as clean as we can. And we'll be available to answer your questions, and we'll be available to do your routine care that we know will still happen. I will still have children who jump off the couch and get concussions, and I will still have children who are sick. And certainly I'm going to have a lot of children that are stir crazy. So I hope that this is encouraging to you and informational. If you have more questions, our staff is available, but also refer back to our website where we have updates on a regular basis.